Hello, good morning, ma'am and sir. I'm Andrea S. Venegas, your student from BSM 3D. And now, for this morning, I'm going to demonstrate the delivery room technique. And for assessment, first we need to assess the patient capabilities for cooperating, assess the patient needed assistance as necessary, and we need to assess the patient for if the patient is already in a second stage of labor, which is if the patient is the cervix is fully dilated, if the patient is with urgency to push, and also is um, if the patient if the amniotic fluid of the patient amniotic if the amniotic fluid of the patient is rupturing, and also assess the patient for vital signs and the fetal heart rate of the baby. And for planning, check the temperature of the delivery room and check for the presence of air drop. Also, prepare the delivery room table, position the steer up, places the calipad, and also the bucket receptacles, and um, the gooseneck lamp if necessary. And now we need to arrange the supplies in the Mayo table, which is the 2 pairs of sterile gloves for handle, 1 pair of sterile gloves for assist, tooth forceps, Mayo scissors, Kelly clamp, sterile cord clamp, bandage scissors, gauze sponge, chromic suture, 5 cc syringe for local anesthesia, needle holder, pick up forceps in holder, oxytocin ampule, 3 cc syringe, cotton balls in canister, kidney or placenta basin, BP up and stethoscope, dry towels or linen for newborn, bonnet, diapher for mother and infant, rectal thermometer, eye prophylaxis ointment, vitamin K ampule, Hep B vaccines, T syringes or 1 cc for perineal prep tray, sterile water for perineal flushing, clean gloves, and also the betadine swab. And the other supplies is assuming na lang po. And now I'm going to introduce myself to the client and identify the patient. Hello, good morning, ma'am. I'm Andrea Espinarios, your student nurse from University of St. Anthony. Ako po ay magiging nurse niyo po ngayon. For verification lang po, may I know your name, your age po, and your plan po, ma'am. Okay, ma'am, thank you po. And now we need to transfer safely the patient into the DR table. Okay. Assuming that the patient transferred to the DR table, then position the client in a lithotomy position and apply the drapes. Okay. Assuming that these pillows is the steer ups. Now, apply the drapes to the patient. And make sure that ensure the safety of the clients in the DR table, and explain the procedure and teaches the proper bearing down technique to the patient. Okay po, ma'am. Ngayon po, yung procedure po ninyo, pag-hinga, pag-inhale, exhale niyo po, ay dapat po, hindi po sa mukha. Dapat po, pag exhale po kayo, inhale, dapat po, pag mag-inhale po, exhale po kayo, dapat po, pag i-erase, dapat po, may contraction. Okay po, ma'am? Then, wash hands thoroughly and observing the proper procedure. Okay? Assuming that I'm done washing my hands and I'm going to put a clean gloves. And we need to perform the perineal preparation to the patient by cleaning the perineal area of the patient. We need to use a cotton balls or linen to wash the perineal area of the patient. And now I'm done doing the preparation of the perineal area of the patient, and we need to wash the we need to remove the gloves, discard, and wash again the hand thoroughly. And now I'm done washing my hands thoroughly, and we need to wear a 2 layers of sterile gloves, and we need to wear a 2 pairs of sterile 2 layers of the sterile gloves. And now I'm done applying the 2 layers of sterile gloves, and we need to encourage the client for the proper down techniques. Okay, ma'am? Pag-iiri po sa back niyo po or sa puwet niyo po, ano po ang pag-iiri niyo, hindi po sa leeg. Okay po? Then, now we need to apply the perineal support for cephalic delivery, and feel cephalic support, then feel the presence of cord coil upon external rotation of the head. Okay. Then catches the head with the non-dominant hand. With the left, my non-dominant hand is the left hand po, and then instruct the client not to push when the head is delivered. Ma'am, okay po ma'am, ngayon po, nag-deliver na po yung ulo ng baby. Huwag na po kayong meron po. Okay po. We need to deliver the anterior shoulder by slightly pushing up and down, then upward to deliver the posterior shoulder of the baby. Then grasp the thigh of the infant in the dominant hand. My dominant hand is my right hand, which then grasp the baby. Then note the sex and the time of the delivery of the baby. And now place the baby on the clean, dry cloth on the mother's abdomen. And thoroughly dry the baby for at least 30 seconds, starting from the face, trunk, and going to the extremities. And also do not remove the vernix caseosa of the baby, because it can help to the thermoregulation of the baby. Then perform the after score at 1 minute and 1 minute of life, then repeat after 5 minutes. Then also place the baby on the skin to skin contact of the mother's abdomen, then covers the baby with a clean dry cloth. And now the baby is in the abdomen of the abdomen of the mother. Now we need to put a clean dry cloth or linen of the baby. Also remove and discard the outer layer of the gloves. And discard it. And now we need to palpate the umbilical palpate the umbilical cord of the baby. Then clamps the cord using the sterile cord clamp at the 2 cm from the base of the base. And another the Kelly clamp, the sterile Kelly clamp, 2 to 3 inches above the cord clamp. Cut the cord using the sterile scissors near from the cord clamp. Okay. Assuming that I'm done in the cord assuming that I'm done cutting the cord of the baby. And now check the cord for the presence of 2 arteries and 2 veins. Okay, now I'm done in the first 30 seconds of the baby. We need to administer the oxytocin to the mother's deltoid as per doctor's order. But first, we need to clean with the muscle or the arm of the patient with the cotton balls with alcohol. Then discard. Then inject the oxytocin to the mother. Inject ko lang the oxytocin. Okay, no? Then we need to perform the remaining step of active management of the third stage of labor, which is the removing or separation of the placenta. We need to perform the Brandt-Andrews maneuver or the Creed's maneuver. The signs of placental separation are suddenly gush of blood, blunting of the cord, and also the fundus of the uterus rises. Now we need to do the Creed's maneuver, which is to remove the placenta by pushing this ganito siya sa abdomen of the patient. Then habang po kapit-kapit yung while waiting to separate the placenta. Then after that, if the assuming that the placenta is separated, and now we need to examine the placenta for completeness and abnormalities. Then put it into the kidney basin or placenta basin. Then Assuming that the placenta is here in kidney basin. Then we need to inspect the vaginal vault and the perineum for the presence of laceration and assist with or repair of the laceration if necessary. Then we need to inspect the perineum of the patient. Then perform the perineal flushing and disinfection. Then dry the perineum using a dry towel and apply perineal pads and diaper. Okay, okay ma'am, lilinis na po tayo. Assuming that I'm done cleaning the perineal area of the patient, and then we need to remove the and discard the gloves and wash hands thoroughly. And discard. Then wash hands thoroughly. Assuming that I'm done washing my hands thoroughly, at the 15 to 90 minutes, we need to do the newborn care, which is to initiate proper launching of infants in the mother's breast. We need to advise the mother to observe for feeding cues. Okay po ma'am, we need to kailangan pong paliguan yung baby. Then hold your baby first. Then, and now we need to perform a newborn care, which is check the temperature and patency of the anus. Okay po ma'am, i-ano lang po natin yung temperature ni baby. And now I'm done checking the patency of the anus of the baby. Kailangan po na i-check ang anus ng baby to make sure po na may butas po yung anus ng baby. And then we need to administer the eye prophylaxis to prevent blindness caused by infection po. Then we need to administer the vitamin K to prevent serious bleeding, and we need to administer the Hep B vaccines to prevent babies getting a hepatitis B, and administer the BCG vaccines to protect against severe forms of TB in the infants. At 90 minutes to 6 hours, we need to transfer the mother and infant to ward via stretcher while maintaining skin-to-skin contact. Assuming that we transfer the mother and the infant po, then place the mother on a flat bed for the first 4 hours. You know? Now the patient is in a flat bed po. Then monitor the vital signs, check for the uterus for the proper contraction, massage if necessary, then check for amounts of the vaginal bleeding and promotes client's comfort. And every 15 minutes for the first hours, then every 30 minutes for the next 3 hours po. Then for evaluation, evaluate the mothers if she is comfortable and with stable vital signs, uterus is well contracted, no signs of profuse vaginal bleeding, and able to breastfeed the infant, and no signs of infection. And for the infants, evaluate if there is no sign of respiratory distress, if the also the thermoregulation, and if the baby is properly latched to the mother's breast, and to the mother's breast to breastfeed. And also in the documentation, we need to document the date, time, medication that we administer, and the procedures done. And also we need to document the mother and infant response to the procedure.